Thanks, everyone. It's great to be here. So I am a volunteer with the IEEE, just so you know. I do have a day job, but I do push myself hard so that I could do things like this and come to these wonderful meetings and meet folks like yourself and talk about things I'm passionate about, and that's innovation and the intersection of engineering, biology, and medicine. And so you probably don't know the IEEE, the International Electronic and Electrical Engineering Society. I volunteer with the EMB, which is the Engineering, Medicine, Biology Society. And as you heard, I'm the editor-in-chief of the flagship magazine. Whoops, what happened here? Thank you. Our flagship magazine is IEEE Pulse. So as part of our outreach in the society, knowing that there's a lot of interest at this intersection of biology, medicine, and engineering, that we started this new initiative called Pulse on Stage. And our first foray in terms of getting these sorts of forum together to be part of discussion in important areas such as health IT, that we started, we had our first Pulse on Stage at the HIMSS meeting this year in February in Las Vegas. So we had a session around the EMR sponsored by JAMA, the Journal of the American Medical Association, and there was a lot of interest. That's when I met Sri, who then invited us to come and do the same thing here, but in a slimmed down format. So today, for the next hour, we'll be talking about the future and impact on healthcare of the Internet of Medical Things. So can I have the next slide, please? So I'll just tee it up a little bit. And you're probably all familiar with the Internet of Things, but the Internet of Medical Things is essentially the same, but instead of just exchanging data, these embedded sensors and making decisions through these interconnectivity of these different objects that are then instrumented in sharing information and and collecting and sharing information. That's all about health data. Can I have the next slide, please? So this is an area that, as you can well imagine, that as we've heard earlier today, this is exploding in terms of the number of devices that have these types of this type of interconnectivity. Of course, you know, mobile phones, that's sort of the forefront. But we heard earlier today about coffee pots, and you know, the thermometer in your home, for example, is another example of that sort of device. But it's estimated by 2020 that over 35 billion connected devices will be on the market with a cumulative value of over $11 trillion, which is actually pretty amazing. Of that, I'm here, thank you. Okay, great, thank you. All right, and of that, the Internet of Medical Things, which is a subset, but also a very fast-growing subset of the Internet of Things, is valued at least over $100 billion. I think that's actually an underestimate, given that the pervasive nature of healthcare in our society. So you can imagine that at the forefront are wearable devices, mostly in consumer healthcare, like the Fitbit, but also wearable devices such as insulin pumps and sensors are now instrumented in communicating with themselves and with an external network. Patient tracking is another area that is becoming more prevalent in hospitals, but also other areas that you don't normally think of that are becoming part of the Internet of Medical Things. In the operating theater, that instrumentation is being now integrated so that one can have a more safe environment for patients and be able to catch errors before they become catastrophic. In the pharmacy and drug adherence is another area that this sort of instrumented things that is capturing data on pharmacology, drug use and such, both in clinical trials as well as in the marketplace. And finally, in large instrumentation, like in the radiology suite, that again, this is where the large industrial players like Siemens, Philips, and GE are playing. And then also these are things, very large things, that are also instrumented in providing information on their operation, on the data being generated in analyzing an individual, but also the machine operation itself. So given the pervasive and increasing pervasive nature of the Internet of Medical Things, one of those critical issues that will ultimately impact the adoption and utility of these devices. So we heard two talks now that touched clearly on the area of security, which is a very important issue, and I put that as number one. But things like data privacy, we heard a bit about that. Interconnectivity and interoperability is another key issue, that you have all these devices out there. How could they talk to each other in a very seamless way? Well, that leads into the concept of standards. Of course, is the idea of data integrity. We heard a bit about that. Analytics and interpretation, the big data, deluge of data. How does a clinician, we heard that earlier in the panel that this morning, how do clinicians deal with all this information that's coming at them? And so, for example, John Halamka talked about the communication between his wife and her primary care provider over mobile phone. That sounds great, but that's just one patient. Imagine multiplying that by the 30 or 40 patients that a clinician, a primary care sees every day. So that one has to start thinking about how to manage this data and make it more informative and ultimately actionable. There's the infrastructure element. And also interfaces and connectivity across medical domains. So going from different silos within an organization, how this Internet of Things can actually break those, what is the best way to break down those silos to get the best value out of this interconnectivity. And finally, there's a regulatory environment and also the business case behind why would I even care about this. So that's what we'll talk about today for the next hour. I have a panel of experts here that has graciously agreed to join me on the stage. Gaurav Datta, the CEO of Cal2Cal, Hector Rodriguez, National Director of Health and Life Sciences at Microsoft, and Jack Poe, Product Manager at Google Health. So how we've organized is that each of the panel will speak for about 10 minutes on a range of topics within the list I just showed you. And then we'll have the remainder of the hour, roughly, say, 25 minutes or so. We'll have some Q&A up here, but also I want to get the audience involved because I think this is such an important area and such a fast-moving area that I think there's a lot of interest in understanding where really underpinnings of the Internet of Medical Things, and the key issues that are driving it, but also how it could be important to you in your own work and in your own organization. So with that, I'll ask Gaurav to come and take the podium.
Thanks, Colin, for the introduction. Good afternoon. It's my pleasure to be here in front of you. You have a little bit of glimpse of what I do. Some are familiar items for you all. I spent quite a bit of my time in the standards space, working with HL7, HIMSS, IEEE, and other organizations like HIMSS and ACM. As a part of my day job, work with ambulatory providers. We specialize in assisting small to medium-sized practices. We are their CTO, CIO for these small organizations. So quite a bit of work we do extensively in the healthcare. But really, let's focus on IoT and health and what it's all about. But even before we go there, this is the afternoon session. Right after lunch, we are sort of dimming down. And why should I be the one wearing the tie? I looked at my panel. No, none of them have a tie. So guys, let's take this out. All right?
All right.
Let's take it out.
You gotta stop there.
There you go. I don't want to show you my IoT device embedded on my body. All right, so let's start with some layman definition. Forget the tech talk. This is an afternoon session right before the closing plenary. You guys want to go home. Let's take some layman definition out of the way. This session is supposed to be IoT. So what is IoT? Even before we go there, let's have a philosophical question. What is life? In a very simple layman's term, a philosophical question, but a very simple answer I'm looking for. Life is in terms of how we relate to life. Somebody's alive, somebody's dead, whether that table has life or not, whether this mic has life or not. The way we equate is something in terms of if it is an entity, it's a human being, it's communicating with you, talking to you, interacting with you, we sort of say it's life, right? So and then anything else is inanimate, it's not alive. So the next question which then comes in is obviously what is IoT, Internet of Things? So very simply put, the way I see IoT as when you give analog devices, table, chair, toaster, thermostat, life, which means it gives it the ability to communicate, to talk to, be part of the network, becomes IoT. It is important to understand this definition because if you ask most people what is IoT, They will give you examples, thermostat and toasters and the refrigerators being the few, but they cannot articulate what is an IoT. So think of IoT. So once you understand what IoT is, it is any analog, inanimate object. You've given it the ability to communicate and be part of the cloud, part of the network, is an Internet of Things. And the way I spin, maybe the new term I want to use is hot stuff, HOT, health of things. Anyway. Let's walk down the memory lane. So as I told you, this presentation is not about IoT. So it's about, walking down the memory lane. Hopefully, some of you may remember, British Royal Army Medical Corps carried out the first successful blood transfusion, which was stored and cooled, way back in history. Try to see if you can figure it out. I'll start giving you the clue. BMW was born as a company. So I'm talking about way back in history. Toggle switch, the switch we have in this country, up and down, that was invented this year. And then the next one will give you the clue where I am. Okay, not the next one, the one after that. Boeing was born. Okay, we are really going back. That's your clue. The World War I was continuing. So I'm really talking about 100 years before, 1916. So think of 1916 and think where we are today in 2016. If you are fascinated with all the innovations which are going on today, think of 2116, where will we be? And that's exactly my point of my presentation for the next few minutes, is just give you a sense on where we'll be in 100 years from now and how we as a community are interacting and reacting and getting ready for it. What has led to this change, the fast-changing space, and there's a couple of things. It's the mobile revolution and the IoT revolution. Mobile phone market has exploded. The next few bullets I'm going to quickly zoom through, but the point being, it took us 20 years to sell the first billion phones globally. And then over the next few years, in the last year, we sold 1.2 billion smartphones. Just think about it. It took us 20 years from when cell phone was invented to sell the first billion, and then just last year we sold over 1.2, not just cell phones, but smartphones. So we are obviously in a fast, changing, evolving world, which we all know of. How many of us are carrying more than one cell phone? All right, this is a very heartening change, an interesting change. When I would ask this question in the past, only few hands will go on. And when I give this talk in other parts of the world, Asia in particular, almost all hands go up. There I have to ask the question, how many of you are carrying 3 cell phones? Then I see a few of the hands. It's interesting. But then if you think this was impressive, and Colin talked about it, IoT connected world by 2020, we are talking about a lot of devices. Over 50 billion devices are being projected. All right, so that's the basis of where we are in the next 100 years of evolution. So let's look at what's healthcare in the 21st century is going to look like. Okay, the next set of, this particular slide is packed with information. The slides are available for you all later on, so this is the best one, I love it. What I call the next generation, the iPad kids. You just have to look at your kids or grandkids, and you will know what I'm talking about. They are the ones who are sitting at tables, a bunch of them, but they don't talk to each other. They text to each other. They are the reason why the grandparents now have a cell phone. 5 years ago, when I would ask my audience how many of you have cell phones, many of them said they don't have. Today, all of them have cell phones. They may not yet have an email, but that's what I tell my providers. 5 years from now, they will have an email because that is the only way they can communicate with the grandkids. So yes, we are in a fast-changing world, and we have to understand and accept. And this is what I also tell my providers. You are serving not your current population, but really your future population, which is the iPad kids. They are not going to pick up the phone and make an appointment and change an appointment. They're going to go to your Facebooks and other devices and make changes. And if you're not ready, you are not ready. Impact of social media, the blurring of lines of what is private, what is not private. Our world, our concept of security and privacy is way different than what my kids, our kids think of. The kind of information they share today in the net without thinking about it is absolutely amazing, and for many of us, we still scratch our head. But we have to understand and recognize this is the future. So we have to build our solutions keeping that in mind. This is the best one. We want our information now. We can't wait for it for even 5 seconds. And I'm sure all of us can relate to that. And I'll use my family's example. If my son hasn't responded to my wife's text, mom is worried. What is going on? Why hasn't he called me back? We want that information now. We want to be connected. The point is, this is not a joke. This is the reality. We want our information. And I'm sure many of us will nod when I say that you do wake up in the middle of the night, just look at the cell phone. Was there a message for me or not? Or you have the buzz, you wake up, look at it, and you move on. So we have become tuned to having that information. So what are we doing about it? This is the best one I love. Ask your parents, your grandparents. They would follow the advice of the doctor and never question it. Today, to quote my good friend and also my PCP, he says, Gora, it's because of your wife, I have to keep my knowledge current. Before even I complete the sentence, he's Googling what I'm saying. And therefore, so we are living in a world where as consumers, we are taking charge of our health. We don't take things for granted. We question everything. We have the Fitbits and you name it, whatever devices, monitoring devices. So we have to have an environment where we are providing that information to the consumer. And that's the reason we are seeing the increasing patient engagement, patient-generated data, all coming into the mix. So it's really critical for us to understand that. You guys can see my bias of where I'm coming from in terms of my bullets. Gene to gene. What was depicted as science fiction in the 60s, Star Trek, is now a reality as we all see. The cell phones, the communicator, and so on and so forth. Well, this is the interesting one I always talk about. People take a little bit of double take. You take any of the current tech pioneers, and I'll name a few just for illustrative purposes. Jeff Bezos of Amazon, Zuckerberg of Facebook, Elon Musk, or Tesla, anybody. All of them are spending millions, investing millions in space flights. The point being, soon, space flights are not just for astronauts. It will be our family members, us, if not us, our next generation. And they'll be going in the far, far, far places where we haven't gone before. The point being, what about our health data? When the astronauts go up, and NASA has all the health data available, but when we as humans, as citizens, ordinary citizens will be going up, and we have a health situation, how does our health history, health data go back and forth? We do not have existing ways of figuring that out. Well, this is an interesting one I call longitudinal health record. We see our doctors, we see our PCPs, we go to hospitals, we go to multiple hospitals, we go to multiple PCPs, so our health record is along our longitudinal life. And guess what? Thanks to genetic health, it's not only our life, after that, which means our health record has to survive at least over 150 to 200 years, if not more. If the two generation down wants to know what had happened to us, guess what? The best of the digital media where you store information today has a life not more than 50 to 70 years. We have some challenges which we need to resolve. So I'm not proposing any answers at this point of time, but I'm just trying to set the stage where we will be over the next 100 years. Again, so if the data has to reside for such a long duration, over 100 to 200 plus years, what about its provenance? We travel overseas, many of us. We live in a connected world. We have health situation. That's life. That's human for us. Today we may be getting data, we may be getting some labs done somewhere else. Medical tourism is on the rise. What kind of information is coming in? What is the provenance of the data? How do you know that's not been hacked, that data which has been provided to you? Yeah. How do you preserve that data? How do you get the chain of custody? Many of you, as CIOs, know that EHR is a legal record. The courts are closely looking at EHRs, and so that you have the chain of custody or not. We are on the IoT session. IoT is not the only big item. Big data, open data. So these are evolving ideas, these are evolving concepts we got to be mindful of. Just for those who may not know, big data, I'm sure we all understand. IoT, you definitely understand. Open data is basically making public data, which is normally owned by the government, available back to the public, freely available in a manner which the public can consume. As citizens, let's say you go to a new city, you want to admit your child to the school, you want to know the air quality, you want to know different kinds of health parameters, so that's open data. And I already touched upon global village. We live in a connected world. No longer what happens in the remote village of China, maybe, is here at our doorstep tomorrow as SARS. What happens in a remote village of Africa comes back to us Ebola tomorrow. So the point being, we live in a connected world. We have to make sure what happens somewhere else, just from our own self-preservation point of view, we have to make sure that the data is connected. Somebody has to pay for it at the end of the day. And one of the evolution we will see as we go through the cloud and cloud computing, there will be microservices. And how do you pay for these small transactions? So these are some of the solutions which are still yet to come, but they will come. And the last one, we got to take care of ourselves. And as we heard in the last two speaks, security, cybersecurity is a big issue. Almost all my providers I work with, and remember, these are small to medium-sized providers. They do not have the CIOs as in the audience or the departments as in the audience. Almost all of them have absolutely no idea of the cyber threat they are living in. And I continue to tell them the question is no longer if, is when. It's no longer if you will get hacked. You will get hacked, period. Question is, when will you get hacked and what you have done before, during, and after. So there are some thoughts. So in summary, so as we transition to the digital record framework, as you can see, use of mobile health, obviously we lead the way. Just as a full disclosure, I'm the chair of the HL7 mobile health work group, so I have to plug in mobile health. But the point being, as mobile and IoT devices become more and more ubiquitous, accessing our health information is just a tap, swipe, or a transmit away. And therefore, the way I see healthcare in the 21st century, it is the cloud-connected, IoT-driven, microservices-enabled mobile health enterprise. Days of monolithic single EHR is gone. Soon in the next 5 years, you will not have one large EHR. So those of you who have implemented large EHRs, start planning for the next 5 to 10 years, because it is going to be a change. Thank you.
Thanks, Gaurav, for that. Thanks, Gaurav, for the very provocative and disruptive vision. Hector?
Thanks, Colin.
Sure.
Okay, thanks, everyone, and hello. And again, my name is Hector Rodriguez. I'm from Microsoft. I'm going to start out with a kind of a bloody story. There's a number of CIOs, CMIOs, CEOs in the room, and I'll pick on Patrick here, who's now, I've known for years, and he's CEO of a small startup in healthcare. If I split his head open, cleaned up the blood, and looked in, this is what we would see. So I won't do that, so I've given you a slide, because way too many sacrifices, and I've been asked to stop doing that. But there's a lot of stuff, a lot of really good stuff. When I first saw this mind map, and I love mind maps from City as Tech, a Microsoft partner, I thought, wow, that's a lot of crap, but that's not the right word. It's a lot of really good stuff. And you've got to see what CIOs, CMIOs, chief transformation officers, the innovation officers, but everybody in a healthcare organization is thinking about this. So we've got to make sense out of it, because they're all solvable problems. Can't solve them all at once. It looks like you're trying to boil the ocean. So then we start to talk about digital transformation, which is really what Internet of Things is. And we have a really bad habit in technology, and engineers do this. We give things really scary names. The Internet of Things, digital transformation, it's a really scary set of thoughts. And when you have those conversations, you've got to do a lot of education. It sounds like a really complex problem, but if we address them one at a time, it's very solvable. That's one thing that we learn as engineers and mathematicians. Hard problems are solvable, but you've got to know where to start. So in digital transformation, there are 3 things that I talk about that are non-negotiable. And you heard about security today, data, but also modernization. Everybody in this room, I know, has a pretty new phone, probably a pretty up-to-date car, carrying really nice, sleek-looking devices, hopefully Surfaces. No, just kidding, they don't have to be Surfaces. See, my stock price goes up if I say that. But it's modern IT. You cannot solve the issues we have in healthcare today with population health, with chronic disease. You cannot solve it with old technology. The things that are going on in healthcare today in our biology, the way the world has changed, and to Gora's even graphic of 100 years, I won't ask you to do the math, but we're not solving the same diseases. We don't have the same healthcare problems, so we have to stop acting that way. So we have to embrace digital transformation in this industry. And IoT is digital transformation. And when we look at it, if we start to sort that mind map, we actually have scenarios in healthcare that we can go after that are related to digital transformation. And this is what we talk about when I'm in a planning session or I'm doing an ideation or what we call dreaming, building a book of dreams. You don't build that whole book at one time. You build one dream at a time. And I didn't listen to, I think it was Ed's talk this morning, but he talked about dreaming and getting things done. And guess what? That guy didn't. I just read the preface of his book when he came out. He didn't do it all in 1 year or all at once. It's a body of work, and that's what your book of dreams is going to look like. That's what your digital transformation is going to look like. It's going to be iterative, it's going to be incremental, but it's also going to be agile and really worthwhile going through. The other thing that I will always repeat on this is this all sits on top of modern technology and security, because I'm going to ask the room a question. Who in this room has their data in the cloud, has their healthcare data in the cloud? Yeah, it's a good thing. They know it's there. The rest of you, your data is in the cloud. You just don't know it, right? It's that old adage, there are 2 people in this room, those who know their healthcare data is in the cloud and those who don't. Our healthcare data is already in the cloud. And that data is really relevant to a lot of people, including cyber hackers, but it's really relevant to people who are trying to do good things also. So when we look at the triple aim, we do have to start with why. The triple aim is an amazing framework when you read into it and you understand what the objectives are. But one key point of the triple aim is we've got to stop doing the things we were doing. And one of the things they say, it's a line I always pull out, is the triple aim states that we need new designs to really address today's healthcare, to really enable the triple aim. And we have a chief medical officer at Microsoft who made the triple aim our gold standard for everything we do. When we talk about healthcare at Microsoft, we start with the triple aim. But if you look at, we were just at the Hospital of the Future event in DC a few weeks ago, and the conclusion that we made was digital transformation in health is really technology-enabled care, Internet of Things care, care everywhere, health promotion and disease prevention that is enabling the internet, enabling the triple aim in a mobile-first, cloud-first world, because that's really what's going to happen. And Colin mentioned it. If we're really going to address population health at scale, we can't do it one conversation at a time or one patient at a time. It's going to have to scale through devices, through connected things. And I'll tell you, everybody in this room, again, has a smartphone. Welcome to the Internet of Things. You're already there with your apps, with your Fitbit and other devices. So on the last slide, I just want to share a quick story. This is one of my early Internet of Things experiences, and it was a smartphone type of device. But this is what success looks like. This is why we do this. Not because it sounds really cool, not because digital transformation is a really cool phrase to use, and everybody thinks you're really smart if you say it or you can spell it. It's because companies like Centene they're a public company. They have to make money. They handle Medicaid cases. They do Medicare also. But Centene had an issue with teenage mothers, so mothers on Medicaid programs who weren't getting prenatal care. They were having a very high rate of at-risk births. So what they did was they created a program called Smart Start for Your Baby. They gave these teenage mothers telephones, smartphones, with apps in order to track them. They were able to use the phone for their own things, because guess what? Teenagers, they're gonna Skype, they're gonna text, right? I have teenagers. That's all they do. You mentioned it, right? They Skype to each other at the same table. They were able to reduce the rate. So an at-risk birth cost about $120,000 to the Medicaid system. They've been able to turn that around and decrease the at-risk births, and now deliver these babies in normal state, keep them healthy through their first year of life, keep the mother healthy, because all of that matters. And now they've brought these costs down to about 10% of what it was costing them previously. So these things are already working. They're working at scale, and they're saving the healthcare system a lot of money. And I don't know if anybody read the news earlier this week. We're at a $3.2 trillion spend in healthcare in this country. We cannot afford. That's an unsustainable, unaffordable model to continue. That's why the Internet of Things matters in healthcare.
And for our last perspective, ask Jack to come to the podium.
Thank you very much for inviting me here. I want to talk a little bit about Internet of Things, as we talked about. So at Google, we think about the Internet of Things not just as a number of devices that collect and exchange information, but we're also thinking about how can these devices actually act on the information. So you probably have had many exposures to different types of consumer Internet of Things devices. There's obviously the Fitbit, the Nest, we have Chrome, and the last one, the white, I think blended it out, but it's a light bulb. And right now, I think many folks look at it as essentially interesting devices, but unclear what the real use cases are yet. Let me tell you about one use case that we think about. It might not be health related, but it's a consumer use case that we frequently keep in mind. So you can imagine that there's a baby, let's say there's a newborn, Jim, who the mother is trying to put to sleep. So we know that the mother is trying to put the baby to sleep by looking at potentially the accelerometer on the watch, by looking at what time of the day it is, by looking at the location of where the baby is, and looking at the location where the mom is relative to the house. And once we know that, maybe we should do something about it. So in this case, maybe the IoT control hub can think about how do we make sure that the baby, once it goes to sleep, is kept asleep. So we start thinking about turning down the volumes of the many devices in the house. We start thinking about potentially closing the blinds. And then if there's a device who will make a lot of noise that's normally scheduled to perform a function, let's say there's a Roomba, we might tell the Roomba to not go vacuum in that room right now. And when the baby wakes up, maybe there's another IoT device that will go and alert the parents about the device. And you can see that this is a very consumer-centric use case. It helps in the person's life, but right now is not in any way revolutionary. But even for that dream to happen, there's a lot of barriers that are already existing. So one is, I'm sure many of you who use these devices have seen that they communicate in many different ways. So some communicate through Zigbee, some communicate through Bluetooth, some uses Wi-Fi. They not only use different protocols, but many of them actually talk to different devices. Some rely on the cell phone, some rely directly on the Wi-Fi router, some talk through intermediate hubs. And all of these is causing a lot of problems into making that joint vision happen. So let's say we're able to combine all these data streams. I think that the biggest question, especially for healthcare providers, is what to do about all of this data. What does it mean to have the entire track of Fitbit data? What does it mean to have all this accelerometer data? There's a lot of folks from different companies, different startups saying that they can essentially go predict different health outcomes based on some of those data streams. But it's right now very unclear what to actually do with that data and how predictive some of those values are. I'm going to sidestep that that issue for the moment and talk about some of the other applications that we've used Internet of Things, quote unquote, on. And most of that is on the industrial side. So on the industrial side, in factories, in different types of monitoring situations, even in the plains of Africa, looking at wildlife, we've started to connect different types of devices and try to use the collected intelligence that comes from the different sensors to make certain predictions. Maybe it is on the plains of Africa, looking at how we can prevent certain endangered animals from getting hunted, to in factories, looking at how to improve operational issues. In those cases, we have folks with a lot of resources who can normalize the different types of data streams, and they can focus on combining the different types of protocols themselves. In many cases, they also own the stack, up and down the entire stack. So let me give you a very concrete example of something that happened internally at Google. So we have a lot of data centers. We spend around $10 billion a year on data centers. And one of the things that we spend a lot of effort on is making sure that they run efficiently. So we spend a lot of effort on cooling the different data centers and distributing the load of the different type of processes that run on these data centers. And we basically right now put in a whole bunch of sensors. And we, for a long time, for the last 20 years, we've basically been manually tuning. We have very, very good engineers who write a number of different rules to try to manually tune this process. It's worked out very well for us. But in the last year, we started to actually combine all these data streams to see whether we could predict what will happen. And if we can predict what can happen, maybe we can actually use machine learning to additionally tune it beyond what humans can do. And this is one case where we use DeepMind, which is a deep learning method, to actually look at all the machine learning, applying machine learning to all the sensors that we put in our own data centers and turning it on. And this is basically a reflection of how much money we've saved and how much less power we consume. And that, I think, is a very concrete example of what you can do if you have the resources to go and normalize all the streams, if you control it up and down the entire stack. So I think a lot of us at Google are thinking about, right now there's a lot of different devices that are standalone, run their own apps, run their own protocols. It is helpful to those who have a lot of time to tinker. I have a lot of these devices at home, but it really does not perform a task for a user. To do that, we are hoping that the industry will get to a point where a lot of these devices will be able to talk to each other, and we'll have some intelligence on top of it to start helping with needs that particular users have. I want to point to some specific needs that I think right now we're struggling with a great deal. I think some of that people have already talked about earlier. One is, of course, security. There's a lot of concern around security. There is actually a lot of concern around ease of use and configuration. There's a lot of concern around just having tons and tons of apps just to control what's in your house. There is some concern on integrating all these streams and understanding what it means. One of the biggest concerns that I have, both for consumer side and for the healthcare side, is actually both on the updates and on the common data, common information models. So we've already seen generations of, given how young IoT is, it's slightly surprising that we've already seen generations of these hardware be outdated because the software APIs no longer work or they're dependent on some service that have died. That obviously cannot happen in healthcare. I'm going to rush through some of these slides. We have some work on different types of layers to help with the IoT. I'm sure many of you who are healthcare practitioners have been in the OR, in the ICU, in many of these environments. I would very much think of these environments as already Internet of Things environments. On the other hand, they suffer from exactly the same issues that we have on the consumer side. We have a Philips hub, we have a GE hub, we have different types of vendor-specific hubs where they talk only with each other, if they talk at all. And in many of those cases, when they only talk to each other, even when they talk to each other, we are only able to set very, very procedural type rule-based alerts, which I think some of you mentioned earlier, which leads to a significant number of alarm fatigue because we're unable to really figure out what the actual need is, and we just end up triggering a ton of rules. So I'm just going to stop here in the interest of having a discussion, and I'll hand this back to Colin. Great. Thank you very much.
Thank you. So, you heard three very different, interesting perspectives, some common threads between them all, which is great. So I'll start off with the panel here, and one of the things that, one of the, I guess, the themes of Internet of Things, medical things, is that information starts with the individual, right? And it's collected in different, in spatially and temporally distributed ways. So at the end of the day, who actually owns that information? Considering it goes into different, it's looked at by clinicians, it's stored in the cloud. So at the end of this, who, in your opinion, who owns that data? Is it the patients? Is it the hospitals? Or the clinician? So what would you like to say?
All right, I'll take a stab at it. It depends. The answer depends on which country you are in. Different countries have different jurisdictional laws. There are countries which specifically have written into their law that the data is owned by the patient, period. No argument there from that country's perspective. There are countries which says exactly the opposite. And there are countries who don't really say what it is. So it's all over. So we have to sort of look into that in terms of from a jurisdictional point of view, number one. Second is, in almost all countries, electronic health record today is a legal record. And therefore, what is the implication of that and the ownership of that? And now, a mix of that, we have the patient-generated data, the data being generated by different IoTs and other devices. How do you bring together? So, interesting question, not an easy answer.
And I also think that we're trying to solve the wrong problem, and we're stuck on that. This industry is stuck on trying to solve that problem, and we shouldn't, because I'll be the first one to say, I'm the patient, I own my data. If you took an image, you can own it for that time being. So ownership is temporal, and you own it for when you need it. Our health data also only matters, unless you have a chronic disease or genetic disease, it's usually within the last 6 months. And we do have to keep that in mind, even though HIPAA wants it to be maintained for 6 years, states for 7, legal people. I think at Microsoft, we keep everything for at least 10. That's really a waste of time. So what I just implore everyone to do, when you think about your data, what problem are you trying to solve? How relevant is it for you right here, right now, for the care that you need to receive? And that's what we need to keep in mind.
Mm-hmm. Jack?
Yeah, so I will give a contrarian type answer. So given that I am a physician, but I also work at Google, as a physician and as a patient, I strongly believe that the data belongs to the patient. I have a belief that there needs to be some way, some mechanism that we have not figured out for patients to consent into some ability for the data to be analyzed. I think right now, large parts of the field is hiding under QI or whatever it is, quality improvement, business process improvement, and simply unmasked scanning through the data. I think right now the industry is immature, so it's okay that that's the state of the industry, and regulation might be harmful at the moment, but I do think we need to figure out a model where the patient ultimately controls access.
So another theme that was in the presentations that threaded through was on the area of standards. And standards can take on different forms in terms of just the data itself, how it's structured, but also the interoperability of the different devices that are instrumented and they're communicating with each other. So Gaurav, do you want to take a stab at your thoughts on standards? And also, I guess the other point of this is standards, does that mean regulation? And that, or is it, can it mean something different?
I'll take the easy one first, which is, am I on? Okay. Take the easy one first, which is in terms of standards in healthcare. There are different entities which develop standards. We have communication standards, we have medical devices standards, we have standards based on documents. So, and there are different entities and organizations. HL7 is one of them. IEEE is another one. So just to give you a sense, ISO TC215 is another organization. These are various standards development organizations which develop standards. And many of these standards are being used at your location as we speak. And in many countries, these standards are then mentioned in the regulation, and therefore it becomes de facto you must have that. So therefore, first of all, so I want to clarify that standard is not equal to regulation. It just depends on whether the country has specified those standards and made them mandatory. If they have, then they de facto become regulated standards. But in terms of the evolution of standards, as we are seeing, it's an interesting space because when the standards in the healthcare started about 25 years or so, we were living in a very different world, the world of mainframe, maybe a client server, and now we are obviously, the world of mobility, world of IoT. Now, in terms of, to answer your question, what's the impact of standards? The answer is very simple. Almost all of us out here is carrying a cell phone. And you take that cell phone to any other country, you switch it on, boom, you're connected. This was not possible 10 years ago. Why it's possible now? Standards. Same thing goes with your laptop. You go to any country, go to any hotel, go anywhere in the world, open your laptop, Wi-Fi, you are connected. I'm an IT guy, been doing IT for the last 33 years. I would sweat 10 to 15 years ago trying to connect my laptop to the dial-up modem and get it to work. We have come a long way. Why? Because of standards. You go to any country, the first thing I do, and many of us do, is go to the ATM, withdraw money. We don't carry cash anymore, or we don't carry, as I try to teach my son the word, many of you will know, traveler's check. They don't exist. Well, we just take our ATM card and draw money. How is that possible? That's standards. So it's really important for us to understand if we want interoperability, if we want to make sure you have information anytime, anywhere, any place, it has to be standard-based.
I'm going to just repeat something he just said. I don't call them standards, I call them interoperability, and that's really what we have to focus on. I go to conferences with the different EMR vendors, and what strikes me really interesting and odd is that they all have their own interoperability conferences, and the others aren't there. So that's not interoperability, people. And even the fact that you can go to different countries and get your money out of an ATM, it's because they're interoperating. They may not be using the same standards, by the way, but they're interoperating. The last thing I'll say about standards is we have to be careful with that, because you look at ICD-9, ICD-10 coding, that's just a way, especially in the US, for doctors to get paid or health plans to pay, and a lot of these coding. So we're overdoing it in some ways. But I do think we need to be more interoperable at the process level, the data level, technology level.
Jack?
I agree.
Okay, fair enough.